My name is Vivien Szilvia Balla, and I would like to present my PhD topic, which is PET-MRI in pancreatic cancer advancing prognostication. I'm a surgical resident and a PhD student. I work in the Kaposi Mór Teaching Hospital at the surgery department. My supervisors are Zsolt Káposztás and Adrián Bíró. And our team has a vision, and our vision is to improve pancreatic cancer survival, and our mission is to look for the best imaging modalities to improve treatment and surgical outcomes in pancreatic cancer patients. We have 3 ongoing projects, all of them is regarding pancreatic cancer. The first 2 projects, it's about PET-MRI, and the last one, it's about stereotactic body radiation therapy. My first project is investigating the prognostic accuracy of PET-MRI on resectability of pancreatic cancer patients, which we would like to approach through a meta-analysis and systematic review and meta-analysis. About the background, pancreatic cancer is a very important topic because most of the cases spread before the diagnosis is made, and it is a very lethal cancer with a really high annual death rate. And 80 to 85% of the cases are inoperable, and most of the patients receive palliative care from the time of diagnosis as a primary treatment. And we would like to decrease the number of the unnecessary operations, because it happens a lot that a patient arrives to our outpatient clinic, we perform the gold standard, the CT, and it determines the resectability, and we take this patient to the operating theater, and in the operating theater, after a long time of mobilizing the tissue and manually moving the organs, we find out that this disease is inoperable, so the patient basically had an unnecessary surgery. And our aim is to evaluate the prognostication of PET-MRI in patients with pancreatic cancer. Our clinical question is, does PET-MRI improve accuracy on decision-making regarding resectability in potentially resectable pancreatic cancer patients? And we use the paired framework. Our population is potentially and borderline resectable pancreatic cancer patients, and we would like to compare the PET-MRI with other imaging techniques such as MRI, CT, and PET-CT. And our reference is resectability determined on surgery. And our desired outcomes are sensitivity, specificity, and resectability. And our hypothesis is that PET-MRI is superior to standard imaging techniques in case of prognostication. And here you can see our key articles, which has the same population, intervention, and the outcomes. And here you can see our search key. The first domain refers to the disease, the second domain refers to the imaging technique, and the third domain refers to surgery. And we conducted the search on the 13th of November in 5 databases, and there is a previous systematic review, but it only includes 1 article regarding PET-MRI. And we also find a Prospero registration, but they are focusing on early diagnosis. And here you can see our flowchart of the selection, and we also performed the citation and reference chaser, and altogether we got 35 eligible articles. And this is our progress. Currently we are doing the data extraction, and we will finish that soon, and then we will move forward to the figures. And about my second project, it's investigating the predictive accuracy of PET-MRI on resectability of pancreatic cancer patients, and it will be a retrospective cohort study. And the background of my second project is very similar to the background to my first project, and I would like to highlight that again, that most of the cases in pancreatic cancer are inoperable, and the unnecessary operations will accelerate the disease because the explored but not resected patients nearly double the 30-day mortality. And this is why it's important to find the best imaging technique for these patients. And our aim is to assess the prognostic accuracy of PET-MRI for resectability for pancreatic cancer patients. Our clinical question, how does the utilization of PET-MRI affect resectability outcomes in patients with pancreatic cancer? And we use the same framework, and our population is potentially or borderline resectable pancreatic cancer patients, And here we would like to compare PET MRI with CT. And our reference is the resectability determined on surgery, and we have some desired outcomes, such as sensitivity, specificity, and SUV. And our hypothesis is that PET MRI has a high accuracy on decision-making on resectability in pancreatic cancer patients. And this will be our inclusion and exclusion criteria. We would like to exclude neuroendocrine tumors because for them the DOPA PET MRI is feasible, but we will only use the FDG PET MRI. And our registry, we collect the data in our hospital in Kaposvár, and the data collection finished this February, and also another center is involved, the Sala County St. Raphael Hospital. And this is my third project, which is investigating the effect of stereotactic radiation on survival in inoperable locally advanced pancreatic cancer patients, which will also be a retrospective cohort study. And about the background, the survival of pancreatic cancer is really low, and for the cases which are inoperable, and surgery is not feasible for this patient, so this can be an alternative, because stereotactic body radiation therapy is a highly precise and high-dose radiation, and to the surrounding tissues, it minimizes the damage. And our aim here is to evaluate the impact of stereotactic radiation therapy on survival outcomes in patients with inoperable, locally advanced pancreatic cancer patients. And our clinical question is how does the utilization of stereotactic body radiation therapy affect treatment outcomes and quality of life for patients with inoperable pancreatic cancer? And here we use the PICO framework, and our population is inoperable, locally advanced pancreatic cancer patients. Our intervention will be the stereotactic body radiation therapy, and we will compare it with standard treatment or no treatment. And we would like to have several desired outcomes, and our hypothesis is that stereotactic body radiation therapy improves survival outcomes and local tumor control in locally advanced inoperable pancreatic cancer patients. And regarding the first project, we would like to submit it in September, and the planned submission date for the other two projects will be in 2026. And I would like to finish my presentation with a quote from Helen Keller, which says, "Alone we can do so little, but together we can do so much." And thank you for your attention.
Thank you for the presentation. Why is it so hard to image the pancreatic cancer and to assess the resectability of it?
It can be difficult and challenging because regarding the anatomy of the pancreas, it has several surrounding tissues and organs. And also, we need to differentiate the tumor tissue from other malformations, such as fibrosis or post-inflammatory changes, and this can be challenging for the imaging techniques, and it's important too.
Thank you.
Yeah, thank you.
Thank you for your presentation. I would like to ask, how is pancreatic cancer marked or localized for stereotactic body radiation therapy?
Thank you for your question. For the stereotactic body radiation therapy, we place the markers in the operating room, which are small metal clips, and we put it around the tumor, so the radiation can localize it easily. Yeah, thank you.
Congrats to your presentation. I have also a PET MRI question. So as far as I know, we don't use it routinely in the clinical practice, so what challenges do you see in integrating it into everyday practice?
Well, PET MRI, it's not widely accessible, so the first limitation would be that most of the hospitals don't have access for PET MRI, and also it's kind of expensive, so the high costs can be also a limitation. And also the radiologists need a training before they can analyze the PET MRI. And I think these are the main limitations. And also, as I know, there is not a universal protocol and agreement for the PET MRI, like imaging sequences and this should be improved.
Nice presentation. What I wanted to ask is there data on the timing of these modalities? Because you can say that one or CT or MRI one is more accurate than the other, but the time here I think is really important, because maybe if one was done a month before the surgery or 2 months before, you know, it could infiltrate the other organs or the arteries. So is there data on time to know?
Yeah, thank you for your question. In my second project, we performed in our hospital more than 120 PET MRI scans, and we made the timing in a way that when the patients went to the CT anyway, very close to that date, within few days, they had the PET MRI, and then they had the surgery.
So similar, perfect.
Yeah, thank you.